Coming up on Mountain News this morning, Kentucky hospitals are becoming overwhelmed as people rush to get tested for COVID-19. And Kentucky lawmakers hear from students about the stigma of mental health issues here in the Commonwealth.
Dedicated to Eastern and Southern Kentucky, this is WYMT Mountain News this morning.
Good morning, I'm Chas Gayhart. It is 6 o'clock on Wednesday, January 12th. Let's go back over and check in with Brandon. And I'm so happy to say tomorrow you'll be standing right here beside of me.
That's right. Back in the studio tomorrow. I got my negative test overnight, so that's some good news. And looking forward to being back with you to wrap up the week that you're filling in for Dakota, who's filling in for Steve. So there you go.
That's right. I can't wait.
First time in 2 years. Exactly. All right, let's get into the forecast this morning. Temperatures on the chilly side, 18 in Jonesville, 32 now in Moorhead. You can kind of tell where the clouds are and the clouds are not this morning, so that's giving you a little bit of a contrast. Also, some southwest winds cranking in, which are really going to push those temperatures up a little bit later on. A little extra to max warming needed on the coffee meter today. It's a little cold out there everywhere, but a little warmer in some spots than others, but below freezing for most locations. 49 is our forecast high today, 44 our average high, and a record high set back on this day in 2005 of 69. Jess?
Thank you, Brandon. Well, West Virginia Governor Jim Justice has tested positive for COVID-19. That's according to a release late last night from the governor's office. The release states the result came after the governor had a sudden onset of symptoms. It goes on to say, quote, "The governor, who is fully vaccinated and boosted, is experiencing moderate symptoms and is isolating at home," end quote. Governor Justice was scheduled to give his sixth State of the State address to the legislature tonight. The address will now be delivered by written message to lawmakers to fulfill constitutional requirements. Doctors say Lexington emergency rooms are overwhelmed from people trying to get COVID tests. They say that is taking resources away from emergencies. All this as cases continue to climb. The highly contagious Omicron variant is sending more people to the emergency room, but doctors say you should go only if you're having major symptoms.
If you feel like you're having something significant, chest pain, your shortness of breath is moderate to severe, those are really good reasons for coming to the hospital.
Doctors say hospital staff are feeling overwhelmed. Many are dealing with staffing shortages and limited resources. The National Guard has been called back to assist with hospitals in Kentucky. Baptist Health Corbin will welcome 10 National Guards on Friday. The Guards will be working in a support role for staff. Some of the duties they will be assisting with include entrance screening, traffic control, restocking supplies, supply delivery, equipment delivery, and escorting patients. This once again frees up staff to assist the hospital in other ways. All counties in the Commonwealth are in the red zone, and yesterday's positivity rate increased once again. The state reported 9,450 new cases, bringing our case total to more than 941,000. There were 9 new deaths as well, putting the Commonwealth's death toll at 12,434. The positivity rate is now at a record 26.79%. You can always find the latest COVID-19 information on our website at WYMT.com. At-home COVID-19 testing is becoming more popular as the pandemic progresses. But what role should at-home testing play in overall COVID detection? WYMT's Alyssa Williams spoke to healthcare professionals on when we should utilize at-home testing and how accurate at-home testing can be.
With the recent surge in COVID-19 cases, people are turning to at-home COVID tests for convenience and quick results. But are they always accurate? Infectious disease specialist Dr. Ferris Cotter seems to think so.
People who go to school, let's say, and people who report to work, they can be tested by a home test every 3 days. And then some studies have shown that 3 home tests repeated every 3 days are equivalent in sensitivity to 98%, like a PCR.
Dr. Cotter adds that if you test negative with an at-home COVID test but feel suspicious of the result or are still symptomatic, it is best to self-isolate for 1 to 2 days and test again. Meanwhile, Dr. John Jones at Primary Care Centers of Eastern Kentucky says you should not solely rely on at-home testing for reassurance.
The at-home tests, I would say, are probably kind of comparable to the rapid screens that some of the clinics have. You know, you got the results back in 15 minutes. And we see false positives and false negatives on a daily basis. So it's really one of those tests. It's hard to count on that for your diagnosis.
Both Dr. Cotter and Dr. Jones agree that at-home testing has its upsides, but Dr. Cotter says at-home tests should be just as affordable as a PCR test.
If you ask me what else can we improve, is we can hopefully these prices will get lower so people can afford them and be able to test in their convenience.
Helping to keep everyone informed during the fight against COVID-19. Alyssa Williams, WYMT Mountain News.
Both doctors urge people to get vaccinated or get their booster if they have not already done so. A well-known scene from a Senate hearing in Washington, D.C. yesterday as Senator Rand Paul and Dr. Anthony Fauci battled it out again. The heated exchange happened during a Senate Health Committee hearing on COVID-19. It all began when Senator Paul questioned Dr. Fauci in his comment on several fringe doctors. As Dr. Fauci was giving an explanation, Senator Paul kept interrupting, leading to this.
So I ask myself, why would Senator want to do this? So go to Rand Paul website and you see fire Dr. Fauci with a little box that says contribute here. You can do $5, $10, $20, $100. So you are making a catastrophic epidemic for your political gain.
Dr. Fauci was referring to an incident that occurred 2 to 3 weeks ago, tying it back to the Senator Rand Paul's social media comments on Dr. Fauci. A bill that would give Kentucky schools more flexibility to deal with a COVID outbreak passed out of the state Senate yesterday. Senate Bill 25 will allow individual schools to use up to 10 remote learning days instead of an entire district calling off. This is in addition to the 10 non-traditional instructional days allowed through the Kentucky Department of Education. The bill passed 31-2. Now it goes to the State House. A measure won bipartisan support in clearing the House Education Committee yesterday. Under the bill, each Kentucky school district's student attendance policy would change. It would include provisions for excused absences due to a student's mental or behavioral health status. The bill makes no change regarding the number of excused absences allowed. Several students spoke about the bill yesterday, saying it helps remove a stigma around mental health for students that may be struggling and not know how to reach out.
Going around these big groups of kids, I would get all of a sudden nervous, and my friends would be like, Amira, what is wrong? And they wouldn't know what was going on. They were like, this isn't like you, and I didn't even know how to explain it myself. And that's why this bill is so important.
The bill now goes to the House. On Tuesday, the American Red Cross declared a national blood crisis, stating this is the worst blood shortage in more than a decade. Along with the Red Cross, many other local blood centers like the Kentucky Blood Center are facing similar issues. Adam Burniston talked with officials about what is making the shortage so critical.
For most blood centers across the U.S., having at least a 3 to 4 day supply of blood on the shelves is safe. However, much like the Kentucky Blood Center, most are facing critical shortages and can't keep up with demand.
Throughout the pandemic, we've been dealing with a day supply or less. We're probably at a half-day supply of blood right now. Not a very safe or comfortable place for us to be in.
That means hospitals and doctors are forced to make tough decisions about who needs blood and who has to wait. But sometimes even those decisions can be critical, especially when disaster strikes, like a tornado outbreak back in December.
It was the blood that was on the shelves when that tornado hit on that Friday night that was able to help people impacted by the tornado. We don't know when disaster will strike.
Now, pre-pandemic, the Kentucky Blood Center say they got about 70% of their supply through blood drives and going to locations, but that has all changed. Now, with the pandemic, it's about 50% at those drives and 50% in person. Even still, officials say donations coming in has slowed down significantly.
Overall, blood donations are down, about 10 to 15% over a normal non-pandemic years.
And while blood centers have seen a decrease in new donors, the biggest hit comes from canceled blood drives due to the weather or the pandemic.
We're making up a little bit of ground in our donor centers, but we're just not able to make up the loss of those units at, school blood drives or businesses that aren't back in person yet.
In Lexington, Adam Burniston, WKYT.
The Kentucky Blood Center is accepting walk-ins only as space allows to follow COVID guidelines, but officials suggest to make an appointment online at kybloodcenter.org.
.610 on this Wednesday morning. It's a cold one out there. Temperatures ranging anywhere from the teens in Jonesville to the 30s, right there at freezing. Actually, a little bit above that in Hazard, 34 there at the airport. So again, teens to 30s across our region this morning. There's a few clouds around in some locations. Other locations not seeing as much. We're heading toward about 50 degrees today, thanks to some warm southwest wind that's going to make it feel breezy at times today, gusting up to 15 miles per hour or better. Mix of sun and clouds for the most part. And as we look at our headlines, we see one more day of nice conditions before a weak disturbance or two tries to work their way into the region. And by the end of the weekend, Saturday going into Sunday, the track of the low that hasn't even formed yet will mean a big difference in what we see toward the end of the weekend. Chas?
Thanks, Brandon. And thank you for joining Mountain News this morning. More news is on the way. Coming up, 3 former officers involved in the death of George Floyd make an appearance in court in a pretrial hearing.